Hello, this is Cynthia. I will be speaking to you about vaccinations for international travelers with a focus on Peru because I was able to go on a TTU HSC faculty-led trip to Lima just a couple of weeks ago. I hope you find this presentation helpful. The learning objectives of this presentation are: review how diseases such as typhoid fever, malaria, and yellow fever are transmitted in Peru, and understand chemoprophylaxis, symptoms, and treatment for the different diseases. This presentation will focus on the disease states mentioned above because healthcare students and professionals are already immunized against diseases such as measles and hepatitis B. Regarding rabies, you will not encounter any wild dogs or bats while in the city, and though there are neighborhood dogs in the impoverished areas, they generally keep to themselves, so the best practice is to leave them alone. Salmonella typhi infects the intestinal tract and the blood. Salmonella paratyphi can cause a similar but milder illness and has a shorter duration. These are both spread by contaminated food and water. Symptoms to watch out for are high fevers, weakness, stomach pains, headache, diarrhea or constipation, cough, and loss of appetite. Some people develop a rash of flat rose-colored spots. To prevent typhoid fever, it is best to take Vivotif capsules or Typhim V injection before leaving. Vivotif is an enteric-coated live capsule, and the regimen should be completed a week before travel. Counseling points include to take 1 hour prior to meal and to avoid alcohol 1 hour before or 2 hours after administration. Typhim V is an inactivated polysaccharide injection that should be given 2 weeks before travel. If someone becomes infected with typhoid fever, treatment includes ciprofloxacin, also known as Cipro. It is a fluoroquinolone which can be given orally or intravenously. If given by mouth, it is 500 milligrams every 12 hours for 7 to 10 days. If given by IV, it is 400 milligrams every 12 hours for 7 to 10 days. Counseling points include to educate patient to report signs of tendinitis, which is an inability to bear weight on a joint or feeling a snap or pop, or any signs of altered mental status, such as anxiety, nightmares, agitation, hallucinations, suicidal ideation, or behavioral changes. Also monitor for severe diarrhea. Another option in treatment is azithromycin, also known as Zithromax. It is a macrolide, and it can be given orally. In one study, azithromycin was found to be just as effective as ciprofloxacin. Counseling points for this include: a tablet can be taken without regard to meals, and then to monitor for severe or bloody diarrhea. The last option in treatment is IV ceftriaxone, also known as Rocephin. It is a third-generation cephalosporin. Dosage adjustments may be needed in patients with concurrent renal and hepatic impairment. There are 5 species of Plasmodium that can infect humans and cause liver and kidney failure, convulsions, and coma. The ones we're concerned about are P. vivax, which contribute to about 85% of infections, and P. falciparum, which make up the remaining 15%. Malaria is spread through mosquito bites, though there is no threat in Lima Province or Machu Picchu. Symptoms include high fevers, shaking chills, and flu-like illness that may appear in 7 to 30 days. There are many options for prevention, such as atovaquone progonil, also known as Malarone, for P. falciparum malaria. Counseling points include to take with food or milk-based drink at the same time each day. For patients who have difficulty swallowing tablets, they may be crushed and mixed with condensed milk just prior to administration. Monitor for vomiting and diarrhea and report to prescriber. Chemoprophylaxis also includes doxycycline, also known as fibramycin, and is a tetracycline antibiotic. Monitor for severe or bloody diarrhea and teach the importance of adequate hydration and photosensitivity precautions. Also instruct the patient to have regular dental checkups. Mefloquine is another option, and counseling points include to monitor patient closely for any development of psychiatric symptoms such as anxiety, paranoia, depression, hallucinations, and psychosis that may persist long after mefloquine has been discontinued. Tafenoquine comes in 2 forms, Aerocoda tablets and Crintafel tablets. Please note that Crintafel is used for prevention of P. vivax. It is important to perform a pregnancy test and G6PD test prior to administration. G6PD is the enzyme that protects red blood cells from damage and premature destruction. Counseling points include to administer with food and swallow tablets whole. Monitor for signs and symptoms of hemolysis, hypersensitivity reaction, and methemoglobinemia, such as blue-gray lip, nail or skin color, abnormal heartbeat, seizures, severe headaches, severe dizziness, or syncope, and psychiatric effects. Treatment regimens for malaria start with Malarone on this slide. Other treatment regimens for malaria are doxycycline and mefloquine. There are different doses dependent on the severity of the infection. Yellow fever is an RNA virus that is related to West Nile, St. Louis encephalitis, and Japanese encephalitis viruses. It is spread through mosquito bites, though there is no threat in Lima Province or Machu Picchu. Symptoms include fever, chills, headache, backache, and muscle aches that can take 3 to 6 days to develop. Severe symptoms are jaundice, bleeding, and shock. YF-Vax is a live vaccine that requires reconstitution and should be given subcutaneously. Avoid use of this in patients with acute hypersensitivity to egg or chick embryo protein. Also avoid use in pregnant women. It is also contraindicated in lactating women who are providing breast milk to infants less than 9 months. Sanofi Pasteur, the maker of YF-Vax, submitted an IND application after depletion of the vaccine in 2017 to allow for importation and use of Stemmeril, which is not licensed in the US. It is used in 70 countries, though, and has comparable efficacy to YF-Vax. There is no medicine to treat or cure this infection, so we need to treat the symptoms. Patients should be told to avoid aspirin and NSAIDs due to increased risk of bleeding. For additional information, please visit the Centers for Disease Control and Prevention website at www.cdc.gov. These are my references. Thank you for taking the time to listen to my presentation. If you have any questions, you can reach me at cynthia.win@ttuhsc.edu.